Hi, today we're going to talk about the integumentary system, wounds, and how to prevent wounds. The skin is the largest organ in the body. It consists of two layers, the epidermis and the dermis. The epidermis is composed of two layers, the stratum corneum and the stratum germinativum. The stratum germinativum receives its blood supply from the underlying dermis. The cells produce millions of new cells every day through continuous division. As the new cells are made, the older cells are pushed to the surface. They begin to die as they leave their blood supply. The cells are hardened and flattened by added keratin. The keratin also makes the cells water resistant. The stratum corneum is composed of about 30 layers of keratinized skin cells. Dead cells are continuously sloughed off or exfoliated through wear and tear. We shed about 40,000 cells every minute. The dermis lies below the epidermis and is composed of dense fibrous connective tissue. The dermis contains collagen and elastin fibers that make the skin strong and stretchable. The dermis contains muscle tissue, blood vessels, and nervous tissue. The sensory structures are also embedded in the dermis. The epidermis and dermis varies in thickness in different areas of the body. For instance, the skin is thicker on the feet than on the knuckles. Intact skin is our body's number one defense against pathogens and infections. Breaks or tears in the skin allows a point of entry for pathogens.
And lets pathogens and bacteria go in. There are many types of wounds. There's cuts, scrapes, puncture wounds, burns, and pressure sores. A wound could be smooth or jagged. It may be near the surface of the skin or deeper. Deep wounds can affect tendons, muscles, ligaments, nerves, blood vessels, and bones. Wounds heal in stages. The smaller the wound, the quicker it is for it to heal. The larger. We're now going to go on with taking care of your wound. Properly caring for your wound means keeping it clean and covered. This can help prevent infection and scarring. For minor wounds, clean your wound with gentle soap and water. Cover the wound with a sterile bandage or other dressings. For major wounds, follow your healthcare provider's instructions. If you see it getting worse, it's time to call the doctor. Avoid picking at it or scratching a scab. This can interfere with the healing and cause of scarring. Sorry. Once the scar forms, some people think it helps to massage it with vitamin E or petroleum jelly. However, this is not proven to help prevent the scar or help it fade. Do not rub your scar or apply anything to it without talking with your provider first. Some risk factors for chronic wounds are history of chronic ulcers, injury, trauma, a burn, lack of nutrition to your diet, poor circulation or blood flow, multiple surgeries. Obesity is one of the big ones for bed sores. Treatments like chemotherapy, radiotherapy, certain medications, trouble moving, weakened immune system. Some things to help prevent wounds is avoiding hot water, fire, sharp objects, and other hazards. Being as active as possible, checking your body for sores regularly, eating a healthy diet, losing weight if you're overweight, managing health conditions, practicing healthy hygiene habits, and skincare. Quit smoking if you smoke. Treating wounds right away with first aid is one of the things to help it as well. The scar will fade and may disappear completely, or it might stay. This can take as long as 2 years. Some scars never go away completely. Scars form because the new tissue grows back differently than the original tissue. If you only injure the top layer of your skin, you will probably not have a scar. With deeper wounds, you are more likely to have a scar. Some of the stages for you to know if your wound is infected is that it goes through the incubation period. That's when you first get infection in your wound. And then we go through the prodromal period, the illness period, and the covalescent period. Factors of impaired skin integrity: decreased elasticity, increased dryness, Decreased vascular supply breaks in the skin that allows the entry of microorganisms. Some signs and symptoms of this could be inflammation, redness, warmth, edema due to the injury of destruction of the tissue. You could also get fever, chills. It depends how far along the infection on your wound is. This is basically all the stuff that can go around with skin and wound and having a wound in your body. One of the big things with elder people are more prone to it just because their elasticity has been lost in their skin and their system does not work like a young person does. It could take longer for them to heal. Their nutrition might not be the same. They can't move as well as we do. Um, that's one of the bed bound things. If you're in bed, you have to make sure you're positioned differently, at least every 2 hours, if not more often, just so you won't get a pressure sore, which could then go into a high risk wound. That's about all for our group. If you have any questions, just let us know. Thank you.
And always remember that the number one way to prevent infections is proper hand hygiene.